Hi, my name is Sean Patrick. I'm from the School of Health Systems and Public Health, together with my co-researchers, Dr. Joyce Shirindi, also from the School of Health Systems and Public Health, and Mr. Jan Yehu from the Department of Architecture, and in collaboration with the Department of Family Medicine and the Center for Viral Zoonosis. This is a bit of information on our project, which is titled Adapting to a New Normal, Understanding the Knowledge, the Attitudes and Practices in Response to the COVID pandemic. So we'll start off with an introduction to the project. We will then look at the trans-disciplinary KAP survey, how that is constructed. I'll touch on the aims and objectives of the study. We will then look at student mentoring and how we anticipate the findings of these students would then be translated either into publications of policy documents. And then lastly, we will give a bit more information on the lead researchers. So on the 31st of December 2019, the severe acute respiratory syndrome caused by coronavirus 2 or SARS-CoV-2 or COVID-19 was first reported in China. It has since then spread across the world and has infected millions of people and causing thousands of deaths. In South Africa, we have put in place quite a strict measures in order to control the spread of the coronavirus. And people's adherence to these control measures is vastly affected by their knowledge, attitudes, and practices towards COVID-19, and especially towards the strict regulations that have been put into place. So in order to mitigate the spread of the COVID-19 pandemic, countries have imposed lockdowns, there have been restrictions on residents, there's been health promotion messages. But what is the effectiveness of these mitigation strategies is also dependent on the compliance of the members of society. And points of concern are the lockdown restrictions and regulations. There's a concern about zoonotic diseases and also the impact that the built environment can have on the transmission of COVID-19. So as a transdisciplinary approach, we are merging the fields of environmental health, social determinants of health, the built environment, zoonosis, policy, and well-being towards understanding the complexity of adapting to this new normal. So a knowledge, attitudes, and practices survey is a quantitative method, and it also provides access to both quantitative and qualitative information if you're using closed-ended and open-ended questions. And what we really like to know is, what do people know about zoonosis, these human-animal interactions? What about spatial conditions, environmental pollution that are creating these unfavorable health conditions? Also, what are people's their attitudes towards social distancing, sanitation, living spaces, and also interaction with animals? And also, what are people's practices to adoption of the new guidelines? How does that impact their daily lives? What about the chemicals they're using to clean their surfaces that might have unintentional exposures? And what are the strategies that they're using to achieve social distancing? So the aim of the study is to understand the actions taken by community members and young adults in response to the COVID-19 pandemic. And we'd really like to know, what are these attitudes, knowledge, attitudes, and practices? What are some of the factors that may be associated with poor adherence? And also, we would like to propose a knowledge dissemination strategy that promotes the youth and the young adult-driven responses to COVID-19 and other future potential outbreaks. There are two students that are currently involved in the project. The one will be looking at determining what are the knowledge, attitudes, and practices, and then also identifying factors that may be associated with poor adherence. The second student will look at policy interrogation and then propose a knowledge dissemination strategy that would promote youth and young adult-driven responses to COVID-19. Some of the mentoring activities that we anticipate is questionnaire design and distribution, data analysis and statistical method training, and also scientific writing skills. So because it is essential to understand the KAP in adapting to these challenging times, the responses will give us a better idea how best to support a resilient generation, particularly in time of crises. And this creates an opportunity for engagement and for upliftment of the communities, especially. We anticipate that it will inform governmental outbreak response measures, including policies, interventions, better communication, and also support the implementation of specific programmatic interventions and policies, in addition to what's already being done, and especially encourage the uptake of disease prevention and control measures. And then lastly, to aid the health system strengthening in South Africa, as you know, we're all striving towards universal health coverage, and it is a good step to understand how people are responding to pandemics, give you a good idea on how to better promote adherence to certain policies put into place. And just lastly, as the lead researchers, if there are any further questions, these are our contact details. Thank you.